Hi there, I'm Nick Deakin and I'm a third year medical student at Bristol and I co-chair the Medical Student Committee here at the BMA.
And I'm Tabara John. I'm currently a final year medical student at Peninsula and I was chair of the Medical Students Conference in York this year. So the medical students have just had their annual conference, which was held in York this year. The Medical Students Conference is a great opportunity for not only the reps to shape policy, but other students across the country as well. And motions are voted on, and that helps shape policy for the year coming. Then later in the year, the BMA has an equivalent for all branches of practice, such as the GPs and junior doctors, at what's called the annual representatives meeting. This is a 4-day meeting held during the summer, where we debate motions from across the BMA and make resolutions based on those. Then, later on in the year, when the Medical Students Committee reforms, they work on all the policies that have been formed from these two conferences and aim to make changes based on those.
This year we've been working on a lot of issues that will affect you nationally as medical students. Our work roughly forms into the categories of welfare, education and finance, and the things that matter most to you about those.
In terms of welfare, we've been working on the issues which matter to students the most, namely student fitness to practice, issues regarding alcohol misuse, and also pastoral support for medical students in the form of doctors for medical students.
We've also been working on issues that affect your education and standing up for you there. So we've been looking at improving selection for the foundation programme, a number of reviews of postgraduate training and the foundation programme itself, and also on issuing you with new guidance for electives.
And in terms of finance, this year we've been working on the NHS bursary review. Earlier on in the year we held some focus groups across the country, which some of you might well have attended. The responses from this were then collated and used in our consultation with the Department of Health. We're also working on the higher education funding review and working on fighting any lift on the cap for tuition fees. And lastly, we've also been working on widening participation, which is designed to widen access of younger students into the profession.
I've really enjoyed working with the Medical Students Committee here at the BMA this year, and I'd really recommend that you got involved as well. We really do make a positive change on all the matters that affect you as medical students.
I've had a great time working on the Medical Students Committee as well. It's a great opportunity to meet fellow like-minded students who want to make a change and can work together in doing so. There's also several ways into this, not only joining the Medical Students Committee, but getting involved in relevant events such as the Medical Students Committee Conference and going to the annual representatives meeting.